Hey guys, welcome to Podiatry Practice Mastery. Today I want to talk a little bit about incorporating new technology into the office. In terms of this is a new technology that Jody talked about at the last Ignite conference. It's called Leneva, and this there's only one doctor that I know locally that's using this. He's using it more for wounds. What this is almost like a scaffolding that is injected under areas where there's fat pad atrophy or ulcers, and it adds some bulk. It's basically like a dermal filler, very similar to cosmetic procedures. And this is something that we can do in the foot, and a lot of people have great results, but I want to talk more practically. Yes, the technique, you can learn that, but how is it that you offer it to patients, and kind of what are my thoughts and how I can start presenting this to patients. So the main way that I present things is I show them with a PowerPoint. So I call it patient presentation. So I've added it to my PowerPoints on calluses and on ulcers. So if you log into Podiatry Practice Mastery and you look at my actual slides there, the ones on calluses and ulcers, you're going to see the pictures that I'm going to use. So I use these pictures. So when someone comes in, they have this issue and I want to address this topic, I'm going to show them kind of what it is, and I show them first, and then what I do is I use something called Patient Education Genius, which is basically a way that I can email or text patients information, and then within Patient Education Genius I'm going to send them an actual handout so they can kind of look at it afterwards, because just because I show it to them once doesn't mean they're gonna remember it. So I'm gonna email that to them. The rep didn't give me any like handouts. Otherwise I could give it to them as well. So that's kind of the thought is how I'm going to present this to the patients. And the way this Leneva works, from what I understand, 1.5 cc's, I believe it costs about $500. And then in terms of pricing, you usually do 2 to 2.5 of the price. So you would charge $1,000 to $1,500 for that injection. And I haven't done them, so I'm not really sure. Usually what I do to start is I'll do it less, or I'll practice one. I think the rep said they're going to give me one to practice. And then I usually do it less initially so I can learn how to do it, learning the technique, and then you can increase the price as you start to see better benefits of it. So that's how to incorporate this. I've incorporated a couple of things recently, not kind of as expensive as this, and it's taken me a while. I want to talk a little bit about that. I've incorporated OniFix into my practice, and also CariFlex. I'm not sure what you guys think of those, if you've tried those. The OniFix, I'm seeing people at about 9 months out now from the OniFix. That's the thing to straighten the toenails. And I've been seeing good results with it. I charge about $100, I think maybe $125 per nail. And I really don't have any issues with price for patients. They don't complain about the price if they want that done. So they are doing that, and I repeat it usually every 3 to 4 months, depending on how quickly the nail grows. And many times, once the 4-month comes, then I'll put another one proximal, and you have 2 of them on the nail at the same time, and I'm actually seeing the nails kind of get straighter. And a couple of them have gotten ingrown toenails, so every time I do put on an OniFix, I'm trimming out the nail edge, just doing kind of like a slant back. That's one thing that I've incorporated. How do I incorporate it? Once again, on my ingrown toenail slides, when I go over options, I say, hey, we can do just take the edge back, we can do a matrixectomy, or we can try this thing which is called OniFix, and that's how patients choose that. The other thing that I've incorporated recently, so OniFix is really easy in terms of how to do it. You have to get a couple of things. You have to get a couple of grinders, which I didn't have. But the technique didn't take me long. A couple of them fell off, but it was kind of really easy to learn. The harder thing to learn was actually the CariFlex. It actually took me quite a few times to learn that, so don't worry if the first ones look pretty funny looking and thick and ugly and things like that. So that's what I found with the CariFlex. If you're not familiar, it's not an acrylic nail. It's actually a resin that you put on there, and you have to have a little bit of nail for it to attach to. A couple of them that I've tried to do without enough nail, and they fall off. And I tell patients that if there's not much nail, I really can't guarantee it. If there's a good base of nail, I do that, and I grind down the nail first. And that's taking me some time to learn how to put the thing on. Basically, if you follow their instructions, you start distal and work proximal. I can do it pretty quick now, but in the beginning, it was just I put way too much on, and it took me way too much kind of grinding it down, because I'm not used to the grinding. I don't use a Dremel in the office. We don't Dremel nails or things like that. So I wasn't really used to doing that stuff. But that's the other thing that's taken a while. How I offer that, once again, it's basically those females that are missing a nail or have an ugly nail. They're the ones that opt for it. I have the little cards, the CariFlex cards in the office that they gave us. But those are the kind of the new technologies that have been incorporated, and they work pretty well. And then the last thing would be the Shockwave. The Shockwave we're doing a lot of in the office, and I was looking at my numbers. I think I had, last month, I think it was 50. That might be a lot for you, might not be a lot for you, but every month we kind of look at our numbers and how many of those that we're doing. So it's a substantial amount of Shockwave in the office, and I find it's really helping my patients get better, more so with Achilles tendonitis than with plantar fasciitis. Occasionally with plantar fasciitis, I'm still having to transition over to cortisone injections, but I'm doing a lot less cortisone. Anyway, those are my thoughts on incorporating this new fat pad treatment, and I'll let you know as I start to practice it, kind of how it goes and everything else. Okay, once again, have a great day. Bye-bye.